Well, I want to start by once again thanking our sponsors, Bob Hughes of the Missouri Foundation for Health, Louise Probst, the Midwest Health Initiative, and Steve Rowling was here before. I know there he is, Steve Rowling in the vet, the president of the Healthcare Foundation of Greater Kansas City, who I've known longer than I think I've known anybody in the room. And we don't want to say how long exactly, Steve. I'm going to leave the data stuff to Todd. I get to go first, by the way, because preceding Park is bad enough. Following him is non-habit-forming activity. I won't do it. Besides, I have age. He's got brains and beauty. I've got age. I get to go first. Steve Miller used a term that triggered a thought that I want to end with for myself today, and that is strange bedfellows. Todd will talk about the data. I want to talk about the human data interface that you've seen here today. In my view, at least, in my roles for over the years, it's as important as the data. You see these two panels, one of very skilled academics from 4 great universities, and one of business people who are in the business of either providing care or sponsoring ways to do it better. You see different sides of the equation. When you think about it, I have been a patient, I've been a provider, I've been a professional counselor, I've been a purchaser, I've been a private sector community organizer, I've been a government official. There is no part in the system, I don't think, that I haven't played yet, and I've long been a believer that you can't separate the different parts of the system from each other and have it work better. The conflicts, you hear people all of a sudden, I saw one of the doctors had up his conflict sheet, which I know the physician conferences always make you do. My view of the world has been for a long time that all those different things that I've done are not conflicts. They're simply different views of the system, and we have to bring them together. I was making a comment a couple years ago in a conference like this, and I said something to the effect, well, I've been working in the healthcare system for 40 some odd years, and I'm still fighting the same battles. And one of my witty friends sitting out front said, well, there's the problem. We get Holland out of it, we'll solve the problems. I want to tell you 2 anecdotes to end up here. About 6 years ago, Arnie Milstein and I, and some of you will know Arnie, he's a physician, Mercer consultant, the Pacific Business Group on Health, chief medical officer, and now a faculty member at Stanford. Arnie and I are working on a project called Care-Focused Purchasing. Some of you may have been, some of your companies were members, actually. And we met one evening with the head of quality for what was then called HCFA, Healthcare Financing Administration, now CMS. And we took her to dinner at a very fancy restaurant in Kansas City. I remember because I bought. And Arnie and I made the pitch that we were putting together data from major companies around the country. We had a number of big companies. I was at Sprint, and we had people from counterparts of mine around the country. And we thought that the only way really to make our data useful was to combine it with CMS HCFA's data at the time, and that would actually make us more informed purchasers. Well, you can't imagine the array of things that made it impossible to do that. Well, we're about to do it. About the same time, we bought healthcare a very complicated way at Sprint. We bought in 50 states. We used all of the big providers, all the big third parties. We actually bought ourselves directly in Kansas City. We outsourced, we carved out all of our pharmaceuticals to Express Scripts, and we had our own data aggregator, MedStat, now Thomson Reuters. And I told my guys at the beginning of one of our plan years, I said, look, I want all those people in the room together, because I want to explain to them that it's my data, it's not theirs, and they're going to give it to Express Scripts. It was part of the deal. I wanted Express Scripts to have it, and I wanted MedStat to have it. My guy said, whoa, they can't all be in the same room together. I said, you tell them they're going to be here because we pay their bills. And they came. They all came. Now, there was a little nervousness in the room, because these were blood and guts competitors, a concept that I supported entirely. But they came and they listened and they cooperated, and we bought better because of it. Two anecdotes. Examples of how things can develop over the years. One of the joys of longevity, 40 years, I haven't gotten out of it yet, I don't intend to soon, is that you begin to see things that you fought for a long time happening. You're doing them, and I thank you.
So I just want to conclude briefly by, again, thanking everybody in the room for just a spectacular, spectacular morning. And actually, I don't want to talk about data, interestingly, because data doesn't excite me. What really gets me excited is how people are using data to help make a difference, right? In the context of a moment where payment is changing to reward value, where care is innovating, where consumers are being empowered. And what's so exciting about this morning, and the thing that just gets me so optimistic about the future of healthcare, is these innovators, right, who are taking this moment, right, by the collar, right, and just diving in and leveraging data and these trends to make a difference that will ultimately make huge differences in the lives of patients all across the country. What I tell folks is I've never been more optimistic than I am right now about the future of American healthcare. It's not because I've been sitting in my office in the Humphrey Building thinking happy thoughts to myself, right? It's because as I've talked to literally now hundreds of innovators, like the ones in this room, and they've told me about not what they want to do, but what they've already done. What they've already done, right? It's like William Gibson, the famous cyberpunk author, once said, the future's already here, it's just not evenly distributed yet, right? Which is true. And I think that much of that future is being written right here in St. Louis. And its implications not just for your community and not just for your state, but for America. Because the kind of leadership, the kind of innovation I saw today is leadership that's going to impact the entire country for the better. And I'm even more optimistic than I was 4 hours ago. And thank you for giving all of us in this room a big shot in the arm. Keep rocking and rolling. Again, may the force be with you, and God bless you as you do this critical work. Thank you so much.
Let me do a few housekeeping items. Thank you all. This has been a great conversation. Thank our speakers and panelists. You were outstanding. We'll be sharing the video and slides from today's events through the Missouri Foundation for Health website. So if you're registered as a participant, you'll receive an email to tell you when it's available, and we hope you'll share that with others. Those of you on Twitter can stay in touch using the hashtag #MoData. You can see that in the corner of your program. And finally, for those who are registered for lunch, we welcome you to transition upstairs for a networking luncheon, and you'll have a great chance to talk with each other about all these great ideas that we've heard. So that concludes our formal program. Thank you very much.